So my background has been into medical devices for the last 15 years. I've worked in US, India, Australia, China, Ukraine, a couple of other APAC countries. Worked on the cardiovascular side, worked on capital equipment and consumables. Got a fair understanding in terms of how do you launch products across multiple countries, how do you look at regulatory, how do you look at reimbursement, how do you look at supply chain, and how do you look at KOL management. So at Monitra, we are trying to solve two biggest problems in clinical cardiology. One is patients faint, and second is patients have these episodic palpitations. Extremely difficult to diagnose. The reason it's difficult to diagnose is, number one is you can't predict when a person is going to have this episode. If I knew I'm going to faint, I would rather be in a hospital than be at any other location. And typically the way the healthcare system is currently structured is you have an episode and all the data is collected after the episode. So all the tests, everything is done after the event. But the information that leads to the event, which is very, very critical for diagnosis, it gets completely missed. So what we have done is we have built a complete platform. It consists of adhesive biosensors. These are like band-aid like stickers where you peel it off, put it onto the chest. All the data from here goes to the phone to the cloud. And in real time, we are able to give insights in terms of what's going wrong with patients. And so that appropriate intervention can happen, very quickly. And we are doing it in some of the remotest places in India at this point in time. So when Minister Dawson spoke about the opportunity, I think we would love to explore that. Two case studies I would like to present. One is, there's a city called Panipat, which is in North India. It's about 2 hours drive from Delhi. There's a patient who had a fainting episode, and the clinicians out there did all tests, but were not able to identify the cause of it. So then they reached out to one of the clinicians who had used Upbeat, which is the name of our product. We shipped our sensors to this gentleman in Panipat. They put on Upbeat, and all the data from there went to the cloud. And within a couple of hours since the monitoring started, we started noticing that the heartbeat was not there intermittently for more than 4 seconds. And that was the most likely cause of dizziness. So we immediately alerted them. They called the patient in and they realized that the patient needs a pacemaker. But unfortunately, they did not have a pacemaker implantation facility out there. So moved the patient from, say, this place called Panipat to Delhi. So from the time, and the pacemaker is implanted there. So from the time of detection to diagnosis to treatment, it happened in less than 5 hours. So that's how we are able to make an impact. That's number one. So this is a world champion in their respective sport, had episodes of palpitations. Now what happens is, especially during semi-finals and finals match, what used to happen is during peak performance, the heart rate used to increase, almost 2.5 times. And the athlete went to multiple hospitals, multiple, diagnostic clinics. They did a lot of tests, but were not able to diagnose. So it just so happened, this athlete went to a facility where we were available early on in our journey. The doctor prescribed Upbeat for a period of 7 days. And we were able to identify the cause of, the palpitations during peak performance. The difference between winning a medal or not winning a medal was to identify this. So we were able to identify that. In addition to it, there were silent events that were happening in the night as well. We picked them up. The athlete was put onto medication and went on to win multiple tournaments. So this got us a lot of attention in the clinical fraternity for the kind of clinical work that we're doing. In terms of, say, monitoring, you will see a lot of, excitement in this space. But two things are important. One is, how do you pick up the signals of interest, in an ambulatory environment where there is a lot of noise? So that becomes important. Second is, how do you crunch this data in real time? These are two areas that we're good at. So this also is being used in neurology right now, specifically for stroke monitoring. So there's a gentleman who suffered with stroke, was admitted to multi-speciality hospital here in Hyderabad. The doctors did all investigations but couldn't identify the cause of the stroke. So in this particular case, they suspected that the possible blood clot may be coming from the brain, from the heart, and they put on Upbeat for a 14-day monitoring. We started noticing a clinical condition called atrial fibrillation. Intermittently, it used to come for 3 hours and go away. And this was considered to be the most likely cause of stroke. So the patient was put on to novel anticoagulants to reduce the risk of stroke significantly. Now, in India, roughly around, say, 25% of all strokes that reach the hospital are such where the doctors do not know the underlying cause. The word that they use is a cryptogenic stroke, and we are trying to create a category specifically for a cryptogenic stroke monitoring for a period of, say, 14 days of monitoring for such patients. So these are 3 use cases I would like to showcase, and thank you very much, T-Up, for the opportunity, and I'm hoping to cling on. Thank you. So I have my device in the back in case anybody would like to see. I'm happy to show it. Just an important piece. The innovation is around the sensor and is around how do we analyze data which is on the cloud, and that's where a lot of magic happens. So this is a conduit for picking up the data. Thank you very much, everyone.